Okay, so the first things that you're gonna need to do when you're getting ready to hang blood on a patient is to verify that you have a physician's order, a signed consent, you need a large bore IV, and you need a blood bank ID band. These are those 4 things. If you don't have those 4 things, you cannot go to lab and get the blood. They won't give it to you. The patient, when they get type and crossed, when you get the order and the patient is type and crossed by the lab, they get this green band put on their arm. They'll have a sticker from here that matches a sticker on the bag, that matches a sticker on this paperwork when you pick it up from the lab. You'll match all of those 3 things. You just have to have a generic order signed by the doctor, and then you also have to have a consent form signed by the patient and the physician. If it's not signed, again, they won't give you the blood. The form that you're gonna get when you pick up the blood matches up with the numbers on here and matches up with numbers on the patient blood band. You'll have that green sticker here, you'll have a green sticker here, and it says blood band number. You'll match it up when you pick it up from the blood bank in the lab. You'll talk to the technologist in there, and they'll match up all the numbers with you. You'll read the paperwork, and they'll look at the blood bag, and then they also cross-reference it to a book that they sign it all out on. When you get upstairs and you start the blood, you have to do a set of vital signs before you start it, and then you're gonna do them according to this, what's highlighted on the sheet, and I'll pass this around so everybody can take a look at it. Then there's places on here specifically that you have to sign. It has to be double checked with another nurse, either an RN or an LPN can do the checking, but one of them has to be an RN. All the places that have to be completed on here are highlighted. There's a spot for the administering RN, so whoever starts the blood has to sign it. Make sure they have a 20 gauge IV or larger. If they don't go get the blood. It's only good on the floor for 30 minutes. The next thing you need to be concerned about is the correct tubing. If you're hanging blood, like packed cells, you have to have blood tubing. If you're hanging plasma, you also have to have blood tubing. The easiest way to remember that is the writing on the blood tubing compared to the writing on primary tubing is red. And it says on there, blood tubing. If you're gonna hang platelets, you cannot use blood tubing because the filter ruins them. They're no good to the patient when they go through this filter and they're torn up. They won't help clot. So you're gonna use regular IV tubing. When you're giving blood, first thing you're gonna do is spike this bag of normal saline on the Y set, and you let it run all the way through the tubing, clamp your tubing, and then squeeze this filter area to make sure that you've covered up the filter completely with normal saline before you let the blood start going in there. If you don't do that, as soon as the blood cells hit this hard piece of plastic, it ruins them. You have to have the filter completely covered. So recap real quick, blood tubing for plasma and packed red cells, regular tubing for platelets. Packed red cells can only be on the floor for 4 hours. Once they've been signed out of the blood bank, and there's a time slot on the sheet when you sign it out from the blood bank, they'll fill in right here what time it left the blood bank, what time and date it left the blood bank, and who the technologist was that signed it out to you. You have 4 hours from that time to make sure that this blood is infused. If it's not, you pull it down and the remainder is sent back to the blood bank. Platelets and plasma both basically can run as fast as the patient can tolerate. You don't want to overload them. Platelets are not going to hurt anything, and neither is plasma. Usually we run them wide open. If the patient starts getting short of breath, if they start having a little trouble breathing, if they have a history of CHF, you're going to want to slow them down a little bit, but they run in about 15 to 30 minutes usually. What you're going to watch for in the first 15 minutes, an RN has to sit in the room with the patient receiving the blood. During that 15-minute time frame, they're just going to be assessing the patient, making sure they don't have any low back pain, they're not spiking the temp, their blood pressure isn't dropping. If any of those things occur, especially the low back pain, it's a transfusion reaction more than likely, and you're going to want to stop the transfusion. That's the very first thing you do when you think there's a suspected reaction. Stop the transfusion. You don't turn the normal saline on because that pushes this remainder of blood all in this filter and all down through here into the patient. If they're having a reaction, you certainly don't want to give them any more. Then you're obviously going to go call the physician. The next thing you need to watch for when you're giving